Hi, I'm Dr. Robert Boydston. Did you know that if you've been diagnosed with hypothyroidism, you have a 90% chance that your current thyroid replacement treatment will never allow you to feel normal? Now, that is a bold statement, but it is a fact. In fact, according to the Endocrine Society, 80 to 90% of hypothyroid sufferers in the United States have low thyroid function because they have an autoimmune disease called Hashimoto's. Now, this is probably a new concept to you. In fact, I doubt any doctor has even investigated or asked the question, what is the mechanism? In Hashimoto's disease, your thyroid is underactive because the immune system has become confused and actually kills and destroys your own thyroid cells. Over time, you have less thyroid cells to produce hormones because your immune system is continually killing them. And that's when you start to get the symptoms of hypothyroidism, and that's probably when you first got diagnosed. Now, there's two really important things to understand about Hashimoto's. First of all, because it is an immune destruction of your thyroid gland, slowly over time you will lose more thyroid cells, and your thyroid replacement dose will have to be increased to compensate for that loss. Now, the second really important thing to understand is that the immune process itself blocks the thyroid receptor sites. You see, the way hormones work is that they circulate in the blood and they attach to cells and create a specific change or response inside the cell. See, with Hashimoto's disease, the immune proteins actually will block those thyroid receptor sites, and the replacement can't help you. See, this is exactly why you feel awful. Sure, they can measure the amount of thyroid hormones circulating in your blood. In fact, this is exactly what they do when they draw your blood. And all it does is it tells us the amount of hormone in the blood, not the response that it creates when it binds to your cells. So sure, your labs may look better after the thyroid replacement, but you know better than anyone that it's not normal. You do not feel normal. See, if you want to feel the way you did before you became hypothyroid, if you want energy, if you want that zeal for life, the ability to lose your weight, not feel cold, and not be depressed, then you must calm and modulate your immune system. See, you need to slow down the autoimmune attack against your gland to a grinding halt and decrease the immune proteins that are blocking your receptors. See, this is treatable. I don't care what the last 20 doctors that you've seen told you that taking Synthroid or some other thyroid replacement was treating your condition. It's not addressing the immune system, and the immune system is the real problem here. And you're going to continue to feel lousy until something's done for it. Now, I look at this in a way that no other doctor does. See, you could stop going from doctor to doctor looking for a better replacement hormone. It's not going to change anything. I know that you don't feel normal. I know that things aren't right. And even though they measured your lab values maybe recently and your hormone values are what they call, they're in the normal range, I understand. We've devised the most comprehensive drug-free program for Hashimoto's in the world. In my special report, I reveal exactly how we can turn your life around. It will go into the source of your problem in great detail. It'll go through all the triggers that may be affecting and flaring the immune system, and our scientific approach to calm and modulate the immune system by utilizing the latest scientific research and treatment protocols. This is a complex condition that unnecessarily causes so many to suffer. I'm going to share with you that there's hope. There is absolutely no reason to suffer. Your first step to reclaiming your life is to request my exciting report that details how you could regain control of your life again and feel the way you used to before hypothyroidism. All you have to do is simply fill out the form that's directly below this video, and we'll rush this report to you. It's that simple.